It's pretty wild how a single building can tell two completely opposite stories. We're talking about the public bathhouse, a space that was once seen as a life-saving solution and then, not even a century later, was condemned for destroying lives. It's a history that's just full of contradictions, and it reveals a ton about who we are.
Okay, so check this out. On one side, you've got this public bath in Chicago, around the turn of the century. It was built for a very clear reason, to bring hygiene to the urban poor and fight disease. It was a weapon. But then, on the other side, the bathhouse becomes this symbol of social revolution, sexual freedom, and just fierce political debate. It's the same kind of building, but these are two completely different worlds.
And that's the big puzzle here, right? How did a building that was designed to fight one pandemic in the 1800s end up at the very center of the political and social firestorm of another one in the 1900s? Well, the answer is a fascinating story about public health, class, morality, and what freedom even means.
So here's how we're going to break it all down. First, we'll frame this whole thing as a tale of two pandemics. Then we're going to go way back to the Victorian era to see why these places were even built. After that, we'll jump ahead to the sexual revolution. Then we'll dive into the intense bathhouse battles of the 1980s. And finally, we'll step back and ask, what does this whole history really tell us about ourselves? All right, so first up, a tale of two pandemics. We're going to see how one simple type of space, the public bath, became this weird focal point for two of the biggest public health crises to ever shape the modern world: cholera and AIDS.
And here it is, the central paradox. It's just incredible. In the 1840s, people were building public baths to save the poor from diseases like cholera. The bathhouse was basically medicine. Then you fast forward to the 1980s, and that same kind of space is being publicly attacked, accused of being a hotbed for spreading the AIDS virus. It literally went from being seen as a medical solution to being labeled a medical problem.
So how did this all even start? To get it, we need to rewind. We're going back to the 19th century, to a world that was so desperate for a solution that it invented the whole public bath movement. Just try to picture the cities of the 1830s. The Industrial Revolution is roaring. People are pouring into cities like London and New York. But these places just weren't ready. You have families crammed into tenements with no running water, zero sanitation, and literal sewage in the streets. It was the perfect breeding ground for epidemics, and cholera was the scariest of them all. It spread like wildfire. But here's the thing. This wasn't just a public health issue. It was seen as a moral one. Before this whole bath movement, the wealthy elite didn't just see the poor as unfortunate, they saw them as morally flawed. As this quote points out, being dirty wasn't a consequence of not having clean water, it was seen as a basic character flaw. And this idea was so common, it got its own name: the Great Unwashed. And that term wasn't just descriptive, it was a judgment. It implied that if you were poor and unclean, you were probably immoral too. So the push for public baths wasn't just about fighting germs. For the reformers, it was also about improving the character of the poor. The movement just took off. It was born out of the terror of cholera in the 1830s. By the 1840s, it was an organized movement in England, and then the idea jumped across the Atlantic. It really peaked in the US between 1890 and 1915. Cities everywhere were building them. But then, just as fast as it rose, it started to fade. By the 1930s, more homes had their own indoor plumbing, and these massive public health buildings started to seem kind of obsolete. A lot of them were just torn down. And you can see the social hierarchy of the time literally built into the walls of these places. They weren't just open for all facilities. Oh no. You had your first-class baths for the well-off folks with more privacy and nicer stuff, and then you had the second-class baths for the workers. In England, the law actually required that there had to be at least twice as many tubs for the laboring classes. So yeah, it was public health, but it was also a way to reinforce the class divisions that were already there. Okay, so now let's hit the fast-forward button. The original public baths were mostly gone, just relics of a bygone era. But in the 1970s, the whole idea got radically reinvented, and this is where our story takes its first huge, dramatic turn. To get what happened next, you really have to understand the sexual revolution. After the Stonewall riots in 1969, the gay liberation movement just exploded. This wasn't just about politics, it was a cultural earthquake. It challenged all the old rules about sex, relationships, and who you are allowed to be. For gay men, it was this incredible moment of freedom, a chance to finally carve out spaces of their own. And the bathhouse became one of those key spaces, but its whole purpose was flipped on its head. Nobody was going to a bathhouse in the 1970s because they didn't have a shower at home. People were going for community, for connection, and yeah, for sex. These places became sanctuaries, safe, private worlds where gay men could explore who they were without worrying about society's judgment. It was a place to finally be free.
So let's just put it side by side, because the difference is staggering. The Victorian bath was all about sanitation and social control. Its patrons were the working poor, and the motivation was public health and this idea of moral improvement. The 1970s gay bathhouse, it was about sex and community. Its patrons were gay men, and the motivation was personal liberation and identity. The very soul of the building had been reborn.
Now let's move to the 1980s, because this is where everything collides. The bathhouse, now this powerful symbol of gay liberation, is about to run headfirst into a terrifying new public health crisis. And this is where the story gets incredibly complicated and honestly really painful. So, in the early 80s, doctors in New York and San Francisco started seeing cases of this weird, aggressive new illness. It was affecting otherwise healthy young gay men. Nobody knew what caused it or how it spread. They only knew that it was deadly. And because it was first identified in the gay community, it was cruelly and wrongly labeled a gay cancer or a gay plague, which attached this deep, powerful stigma to the disease from day one. And this brings us to the core conflict of the time. You have these bathhouses, cherished symbols of freedom and liberation for a whole generation of gay men, and suddenly they're being looked at by politicians and some health officials as these dangerous engines of disease. So what do? I mean, do you shut down a space of freedom to protect public health? That question just ignited a firestorm. The debate was just incredibly messy, with so many different voices. You had New York's own health commissioner arguing that closing them would be counterproductive. It would just drive risky behavior underground. Meanwhile, Mayor Ed Koch was under huge political pressure to do something. The bathhouse owners themselves offered to promote safe sex. And most importantly, the gay community was painfully divided. Groups like the Gay Men's Health Crisis fought closure as an attack on civil liberties, while other activists argued that saving lives had to come first no matter what.
This quote from an AIDS doctor at the time really cuts to the philosophical heart of the whole thing. It's this incredible tension between individual liberty and public health. His point is, look, adults have a right to make their own choices, even risky ones. But that right comes with a huge responsibility, the responsibility to be educated and informed. The entire debate was about this question. Was the answer regulation or was it education? And here's the data that makes this story even more tragic. Look at these numbers. Before the government even acted, the community was already changing its behavior in a massive way, thanks to education from groups like GMHC. The number of partners dropped by nearly 80%. Sex in bathhouses specifically went down by over a third. And get this, condom use skyrocketed by over 1,200%. That's not a typo. The community was not ignoring the crisis, they were actively fighting it.
But in the end, the politics won out. Despite this clear evidence that education was working and behavior was changing, the pressure on the mayor's administration was just too much. In 1985, New York City used state sanitary codes to start shutting down the bathhouses, officially declaring them a public nuisance. And that legal term basically brought this whole chapter of their history to a close. So let's just step back for a minute and think about what this incredible 150-year story actually tells us. What does the strange, contradictory history of the bathhouse really reveal? So what can we take away from all this? Well, first, the meaning of a place is never set in stone. A bathhouse is just a building with pipes, but society projects its hopes and its fears onto it, turning it from a symbol of hygiene to a symbol of liberation and then to a symbol of disease. Second, public health crises are like a magnifying glass. They don't create social tensions. They just reveal and amplify the ones that are already there, about class, about morality, about sexuality. And finally, this whole story shows that the fight between public safety and individual freedom isn't new. It's this fundamental, recurring challenge that every generation has to figure out for itself.
And that leaves us with this one big question, which is just as relevant today as it was in the 1840s or the 1980s. In a moment of crisis, when lives are actually on the line, who gets to draw that line between protecting the community and protecting our individual rights? Is it the government? Is it public health experts? Is it the communities themselves? There's no easy answer, but the history of the bathhouse shows us just how high the stakes really are.